Imagine this. It's 6:15 in the morning. You've barely opened your eyes. The house is quiet, the coffee hasn't brewed yet, and you're doing something you've done 10,000 times before: sitting up, swinging your legs over the side of the bed, and standing. Nothing dramatic, nothing unusual. But here's what most people over 60 never hear from their doctor. The hours between 6 a.m. and noon are the most dangerous window for a stroke. Not midnight, not after a heavy meal, the morning. Researchers call it the morning blood pressure surge, and for millions of seniors, certain everyday habits performed in those first waking hours are silently pushing blood pressure into a danger zone and thickening the blood in ways that invite clots. Today, we're going to walk through these habits one by one. Some of them will surprise you. A couple might even make you uncomfortable because they're things you do every single day without thinking. But knowing them and really understanding what's happening inside your body each morning could be the difference between a normal Tuesday and a trip to the emergency room. Stay with me on this one. It matters more than you think. So let's start with something most people don't realize. Your body doesn't wake up the way it did when you were 35. Back then, your blood vessels were flexible, your nervous system transitioned smoothly from sleep to wakefulness, and your blood pressure climbed gently like a car easing onto the highway. After 60, that process changes. The walls of your arteries have stiffened, sometimes a little, sometimes a lot, depending on your health history. Your body still releases a surge of cortisol and adrenaline every morning, because that's how humans are wired to wake up. But now those stress hormones hit blood vessels that don't stretch and absorb the pressure the way they used to. The result is a sharp spike in blood pressure, sometimes 40 or 50 points higher than your nighttime readings, all within the first 60 to 90 minutes of waking. At the same time, your blood is at its thickest in the early morning. You've gone 6, 7, maybe 8 hours without drinking water. Platelets, those tiny cell fragments responsible for clotting, are stickier and more likely to clump together. Your body's natural clot-dissolving system is at its weakest point in the entire 24-hour cycle. This is the landscape: thick blood, stiff arteries, rising pressure. And into that landscape, you introduce a handful of habits that seem completely harmless. That's where the trouble begins. Habit number 1: jumping out of bed too quickly. The very first one catches people off guard because it sounds almost too simple. Getting out of bed too fast. When you've been lying flat for hours, your blood has settled. Gravity hasn't been pulling it downward into your legs the way it does when you're standing. The moment you sit up quickly and plant your feet on the floor, your cardiovascular system has to scramble. Blood pressure drops momentarily in a phenomenon called orthostatic hypotension, that dizzy, gray around the edges feeling some of you know all too well. Your heart compensates by pumping harder and faster, which sends a reactive spike of pressure through already stiff arteries. For a younger person, this correction happens seamlessly. For someone over 60, especially someone on blood pressure medication, that whiplash between a sudden drop and a sudden spike can stress vulnerable blood vessels in the brain. The fix is almost embarrassingly simple. Sit on the edge of the bed for 60 seconds. Flex your ankles, let your circulation adjust, breathe, then stand. Doctors in Japan have been recommending this for decades, and the cardiovascular data supports it. That single minute of patience reduces morning blood pressure variability significantly. Habit number 2: skipping water first thing. The second habit is one that nearly everyone over 60 is guilty of, and most don't even consider it a habit. It's reaching for coffee before reaching for water, or worse, reaching for nothing at all and simply starting the day dehydrated. Remember what we said about blood thickness. After a full night of sleep, you've lost moisture through breathing, through perspiration you didn't even notice, and if you got up to use the bathroom at 2 a.m., which, let's be honest, most of us did, you lost fluid there too. Your blood volume is lower. The concentration of red blood cells and platelets per unit of blood is higher. This is the textbook setup for a clot to form, particularly in the deep veins of the legs or in narrowed arteries feeding the brain. Drinking 8 to 12 ounces of room temperature water within the first 15 minutes of waking begins to thin the blood back toward a safer consistency. Not hot water, not ice water, Room temperature moves through the stomach fastest. Coffee can come after, tea can come after, but water comes first. Think of it as oil for an engine that's been sitting cold in the garage overnight. You wouldn't rev the engine without it. Don't rev your circulatory system without it either. Habit number 3. That first cup of coffee on an empty stomach. And speaking of coffee, here's where it gets personal for a lot of you. Caffeine is a vasoconstrictor. That means it tightens blood vessels and temporarily raises blood pressure. For a healthy 30-year-old, that bump is minor and clears quickly. For someone over 60 with borderline or diagnosed hypertension, that morning cup can push systolic pressure up by 10 to 15 points, sometimes more. When that caffeine hits during the body's natural cortisol surge, which peaks between 6 and 9 a.m., the two effects stack on top of each other. Now, nobody here is telling you to give up coffee. That would be cruel and frankly unrealistic. But timing and context matter. Drinking coffee on a completely empty stomach amplifies the pressure spike because there's nothing to slow the absorption. Having a small bite of food, first a banana, a handful of oats, even a slice of whole grain toast, buffers that caffeine absorption and smooths out the blood pressure curve. Some cardiologists also suggest waiting until after 9 a.m. for that first cup, once the natural cortisol peak has passed. Try it for a week. You might notice you feel calmer, steadier, less of that jittery, heart-thumping rush that you've always just accepted as normal. Habit number 4, straining on the toilet. This next one is uncomfortable to talk about, but it's critically important, so we're going to talk about it anyway. Straining during a bowel movement, bearing down hard, holding your breath, pushing, creates something called the Valsalva maneuver. Pressure builds inside your chest. Blood pressure spikes dramatically, sometimes by 60 or 70 points in a matter of seconds. For someone with weakened blood vessels, a small aneurysm they don't know about, or unstable plaque in a carotid artery, that sudden spike can be catastrophic. Constipation is extremely common in older adults. Medications cause it. Blood pressure pills, pain relievers, iron supplements, reduced physical activity causes it. Not drinking enough water causes it. And so every morning, millions of seniors are unknowingly performing one of the most dangerous blood pressure spiking activities imaginable in the one room of the house where nobody's watching. Prevention means addressing the constipation itself. Fiber from vegetables, whole grains, and fruits like prunes or pears. Adequate hydration. There's that water theme again. Gentle movement the evening before. And if the problem persists, talking honestly with a doctor rather than just pushing through it day after day, hoping it resolves. Habit number 5. Intense exercise too early without warm-up. Some of you are disciplined. You wake up and you move. A brisk walk, yard work. Maybe you shovel the driveway in winter or haul groceries from the car. And that physical activity is wonderful for long-term cardiovascular health. No argument there. But launching into vigorous effort within the first 30 minutes of waking, before your blood vessels have had time to dilate and your heart rate has gradually climbed, is like sprinting the first mile of a marathon without stretching. Cold morning air compounds this. When you step outside into 40-degree weather, your blood vessels constrict further, pressure rises, heart rate increases. Blood that's already thick and sluggish from overnight dehydration is now being forced through tightened vessels at higher speeds. The sheer stress on arterial walls, particularly at branch points where plaque tends to accumulate, increases the chance of a plaque rupture. And a ruptured plaque is exactly how most strokes and heart attacks begin, not from a clot forming out of nowhere, but from a crack in an existing deposit that triggers sudden, aggressive clotting at the site. Warm up indoors first, gentle stretching, arm circles, marching in place for 5 minutes. Let the body's thermostat and pressure systems calibrate before you demand performance from them. Now, if you're over 60 and watching this, or if you're caring for a parent, a spouse, a neighbor who's in that age range, this information could genuinely be life-saving. Most of what we've covered so far isn't in any pamphlet your doctor hands you. It's the kind of knowledge that lives in cardiology journals and geriatric research papers, and it rarely makes it into a 10-minute office visit. So do something with it. Share this video with someone who needs to hear it. And if anything we've discussed sounds familiar, if you've felt that morning dizziness, that pounding pulse with your first coffee, that breathless strain in the bathroom, pay attention. Your body has been sending signals. Today might be the day you finally listen. Habit number 6, salt-heavy breakfasts. Let's keep going. Breakfast choices play a larger role than most people suspect. Bacon, sausage links, canned biscuits, deli meat on toast, instant oatmeal packets, which, despite their healthy image, can contain over 600 milligrams of sodium per serving. Cheese omelets made with processed American slices. These are staple breakfasts across America, and they're sodium bombs landing right in the middle of that vulnerable morning window. Sodium pulls water into the bloodstream, increasing blood volume. More volume pressing against stiff arterial walls equals higher pressure. For someone already managing hypertension, a single high-sodium breakfast can elevate readings for hours, overlapping with the period when clot risk is already at its peak. Swapping processed breakfast meats for fresh eggs, sliced avocado, unsalted nuts, or fresh fruit doesn't require a culinary degree. It requires awareness, and now you have it. Habit number 7, skipping or mistiming blood pressure medication. This one is for anyone currently prescribed antihypertensive medication. The timing of your dose matters enormously, and yet most prescriptions simply say, take once daily, without specifying when. Many seniors take their pills with breakfast, or even after breakfast, which means the medication doesn't reach therapeutic levels in the bloodstream until mid-morning, well after the dangerous surge window has already passed. Some research, including a large Spanish study published in the European Heart Journal, found that taking certain blood pressure medications at bedtime rather than in the morning reduced cardiovascular events by nearly 45%. The medication was active and circulating during those critical early hours when the body needed protection the most. This doesn't mean you should change your medication schedule on your own, but it means you should bring it up at your next appointment. Ask specifically, would I benefit from taking this at night instead of in the morning? That single question could reshape your risk profile. Now let's talk about recognition, because prevention only works until it doesn't. And if a stroke does begin, the speed of your response determines everything. Morning strokes are sneaky. They sometimes begin during sleep. You wake up and something is already wrong, but you can't pinpoint what. Your arm feels heavy. One leg drags slightly when you walk to the bathroom. Your face looks different in the mirror, one side drooping just enough that you almost convince yourself you're imagining it. Words feel thick in your mouth, like your tongue forgot how to cooperate. You reach for your toothbrush and miss. You try to squeeze the tube, and your grip fails on one side. Many seniors dismiss these signs. They blame it on sleeping funny, on being groggy, on age. I just need my coffee, they tell themselves. And minutes pass, then an hour, then 2, and the window for treatment, the window where clot-busting medication can reverse damage and restore blood flow to starving brain tissue, shrinks with every one of those minutes. The acronym is BFAST, balance problems. Eyes, sudden vision changes in one or both eyes. Face drooping, arm weakness, speech difficulty. Time to call emergency services immediately. Not time to wait and see. Not time to call your daughter and ask what she thinks. Time, measured in minutes, to get to a hospital with a stroke center. Write BFAST on a card. Tape it to your bathroom mirror. Because if it happens, it will likely happen there, in the morning, in the quiet, when nobody else is watching. So what does a safer morning actually look like? It looks calm. It looks intentional. You wake up. You stay in bed for a moment and take 5 slow breaths, letting your cardiovascular system transition gently. You sit on the edge of the bed for a full minute, flexing your feet, feeling the floor beneath your toes. You stand slowly, holding the nightstand if you need to. You walk to the kitchen and drink a full glass of room temperature water before anything else touches your lips. You eat a small, low-sodium bite of food, a banana, a few walnuts, a piece of whole grain bread. Then, and only then, you pour your coffee. You take your medication at whatever time your doctor has specifically recommended, and if that conversation hasn't happened yet, You schedule it this week. You dress warmly before stepping outside. You stretch gently indoors before any vigorous activity. And you listen, genuinely, honestly listen, to what your body tells you in those first waking minutes. None of this requires expensive equipment. None of it requires a gym membership or a specialist referral. It requires attention. It requires treating the morning not as a race to productivity, but as the most physiologically vulnerable period of your entire day, and acting accordingly. Every year, nearly 800,000 people in the United States have a stroke. A disproportionate number of those strokes happen in the morning, and a disproportionate number happen to adults over 60. Some of those strokes were unavoidable: genetics, pre-existing conditions, factors beyond anyone's control. But many of them, a staggering, heartbreaking number of them, were influenced by small, fixable habits performed in the first hour of the day. Habits nobody ever warned them about. You've spent the last few minutes learning what most people never will. That knowledge is a gift, but only if you use it. Start tomorrow morning. 1 glass of water. 1 minute on the edge of the bed. 1 honest conversation with your doctor about medication timing. Small shifts, practice daily, that stack into a profoundly different risk profile over weeks and months and years. If this video helped you see your mornings differently, subscribe to this channel. We create content specifically for adults over 60. Real information, presented with respect, designed to help you live longer and live better. Share this video with your spouse, your siblings, your friends at church, your neighbor who lives alone. You never know whose morning you might change, or whose life you might save. Drop a comment below and tell me, which habit surprised you the most? I read every single one, and your story might help someone else recognize their own risk. Take care of yourself tomorrow morning. You deserve every good morning that's still ahead of you.